and we've produced almost as many data requests. So, a lot of work that has been achieved. Having said that, what most people talk about when they talk about UDRC is they talk about this event actually. So they usually ask us, when are we going to do the next Bagels and Research event? And so I've asked RA if we want to just like not do research anymore and just do Bagels and Research events moving forward. What are your thoughts on that, RA? Yes, no?
I like bagels.
Yeah. Who doesn't? So thank you so much again for attending today. We really appreciate it. I'm going to pass it over to Ari, who's going to kick it off our event. Thank you.
Thanks again, everyone, for being here. So just going to quickly go over the schedule and what we're going to do. So we're doing 2 blocks of research. In our first block, we're going to have Catherine Ruetschlin from the University of Utah's Department of Economics. We're going to have Connor Hill and Alicia McIntire from UDRC presenting. To squeeze in 2 extra presentations this year, I'm going to ask that we hold all questions until the designated Q&A, unless they're small clarifying questions. So substantive questions for the end, clarifying questions for the beginning. And then as well, unfortunately for us, Catherine is going to have to leave early. So I guess if you need to ask her slightly larger questions than small clarifying questions, so I'm going to contradict myself immediately. Feel free to do so. So yeah, I'm going to invite our first group of speakers up and turn the time over to them.
All right, you want us to come up there?
Yeah.
Okay.
Sorry.
And I'm going to come back here after I present.
Yeah.
Okay. How do we get to the slides? Just click?
Yep.
Okay. All right. Hi, I'm Catherine, and I'm going to present some research that I completed over the course of about 5 years with the Office of Childcare out of the Department of Workforce Services. This research began in early 2020, just before COVID. And then, of course, when the COVID crisis hit, childcare became a really hot topic. And so I'm going to give a kind of smattering of what we dug into over that period and the implications it has for policymaking around childcare in Utah. Before I dive into that, I want to just say that I'm super happy to be here, especially because I think Utah's really unique in that it's a state that highly values data collection and the use of data to inform its policy. I have really benefited, in a time when nationally representative data is having a hard time with response rates and is simultaneously being hit with funding cuts that are going to make those problems even worse. I've benefited from working with populations in this project and in my other projects that really carry the burden of data reporting. And I think that that's, a huge win for Utah, because if we want to have evidence-informed policy going forward, the states are really going to have to pick up on a lot of that. And you guys have been really wonderful in that sense. So a lot of the work in this material derives from data sources that are unique to Utah and are the product of that environment. So that's really what I'm going to talk about a lot today. But the research itself covers a number of publications that really cover what I think of as the 3 sides of the childcare market. One side is the household side, seeing the prices households face and their ability to access providers at all in the market. That information comes from the Childcare Market Rate Study, which is produced every 3 years for the state as part of its federal reporting requirements. And that study is used for reporting prices in the state, for information for consumers and producers, but also for subsidy rate setting. The next part of the market that we look at is provider sustainability. So estimating the cost of care, looking for gaps in the market, why some populations have a lot of service availability and other populations do not, that sort of thing, and finding ways to support increasing the sustainability of childcare markets across the state. And then finally, the sort of third side of the market would be the childcare labor force. Folding in considerations about attracting and retaining highly qualified workers in the area of childcare, which obviously was a big problem over the last 5 years or so. So we're going to start with prices, and this data comes from a combination of administrative data that providers are required to report to the state in order to be eligible for childcare subsidies. Also, the state of Utah has a quality rating system. So some of the data comes from that quality rating system and the requirements imposed there, but also from self-reported provider surveys. So a lot of information drawn from a sample of providers. And so this data represents all active programs in the state of Utah. And that sort of combination of data banks is weighted by the capacity of providers, so that what you really see in these numbers is what a family going out into the market and looking for childcare would see, right? So it represents the influence over prices of large providers, and it represents the experience of seeking care. So in this data, you might know, if you're from one of these counties, that there are a number of counties with no providers at all. And even more counties with just 1, 2, or 3 providers in the entire area. And so the geographic weighting of this data is also really important to the results. The prices of childcare at the median for a full-time, one single child in full-time care are here, and it's not going to surprise anyone to see that they're pretty high, right? They are higher for care in a center-based facility than in a family licensed, that is an at-home care provider, right? They are highest for the youngest kids, because those are the kids that require the most direct personal resource attention, right? So high costs associated where caregiver to child ratios are highest, right, at the youngest. And it's not here, but you would see if I had put it up here, rural prices for childcare are a little bit lower than urban prices overall, but not by as much as one might expect. They're really only between 1% and 7% lower than urban. So there's no real kind of market-to-market responsiveness going on in this kind of pricing. So these numbers are what's used to establish the childcare subsidies for the state. The rules about subsidy allocation from the Child Care and Development Fund block grants from the federal government suggest that in order to attain equal access for subsidized families, subsidies should be set at the 75th percentile of prices. And what that means is that a family receiving a subsidy then would be able to go out and access the market that's kind of broadly the same market that an unsubsidized family would be able to encounter, right? They don't have to settle for the rock bottom, lowest price, lowest quality providers in their area, but they can seek out care attributes that they think are important. But that kind of equal access requires allocating this, kind of fixed pot of subsidy money in both its reach to families that qualify for the subsidies and its sort of coverage completeness in the sense that it reaches that 75th percentile of threshold. And in the state of Utah, only about 15% of families that are eligible for these subsidies actually receive them. And so there's a real, tension there between trying to provide the adequacy of the level of funding and the breadth of access to the funding. And as you can see, we target our subsidies more around the 60th or 65th percentile, which is really pretty good in relation to some of the other states, but doesn't reach that sort of equal access threshold. And then at the same time, while almost all providers report that they will accept subsidized children, almost all providers also report that that subsidy isn't enough to cover the price of care at their facility. So this means, there's a DWS designated copay for some families. If your income's a little higher, you might be required to pay, $100 a month or $50 a month toward childcare. Most providers require that copay in addition to the subsidy, but a lot of providers, almost 3/4 of the providers, also require those subsidy families to fill in the gap between the subsidy amount and the price of care, which is pretty extraordinary. It represents a pretty large burden to low-income households trying to enter the labor force, right, and still achieve quality care for their kids. So, one more piece of information on that. This is a mapping of, on this side, center-based facilities, on this side, those household family licensed care facilities, and the ratios of the share of income that's required for the median family in the county to pay for childcare. And again, there are thresholds of accessibility and affordability that are out there. The CCDF has some in their guidelines, but what really comes out of those thresholds is that they are completely unrealistic. There is not a single county in Utah that meets the affordability threshold of the federal government. For center-based care, and this is the most expensive category of care, right? Those kids under 2 that are really resource intensive. But for center-based care, having a single infant or young toddler in care is going to take up to 25%, 27% of the income of the household in order to cover that care. At a family provider, it's not that much better, right? Where we have 10 to 27% of income going to childcare at centers, it's like 8 to 24% here, still pretty dramatic in terms of your budget constraints. And while there is regional variation in the cost of care, some of that regional variation is really because of differences in incomes and not differences in prices. So for example, the eastern non-metro area here, despite being a rural area, has the highest childcare prices in the state. And this is because the inputs to childcare are super expensive there. Labor costs are expensive there. Transportation costs are expensive there, right? So all of these areas face really high costs, but while, say, Wasatch and Summit counties have really high incomes that make that spending a lower portion of their total family budget for the month. Counties like Carbon and San Juan County, Duquesne County, Emery County, those counties in the same non-metro areas have relatively low incomes. Yet the providers in those areas can't respond to those local market conditions with lower prices. So those families are facing pretty extraordinary cost burdens in those areas. And I do have, for other age groups, just to say this is not just for those really, really expensive infant care scenarios. For older kids, like 3-year-olds in this graph, it's pretty similar, right? Like up to 20% of income being spent to access care in a center, 16% of income in a family licensed facility. So then the next question becomes, what is driving these costs, right? How do the prices, if we see these distinctions in affordability and a limited ability of providers to respond to the ability to pay of consumers varying across the state, how do resources relate to these prices? And then there are a couple of possible problems built into the way that we set subsidy rates in the state. One is that if the prices that the providers are charging aren't fully representing the costs that they face for operational costs for their business, then setting subsidy rates at the 65th percentile or even at the 75th percentile is just going to kind of lock in the fragility of the system. What we know is that not all of the prices in the childcare system reflect the costs where they occur. And so subsidy rates alone are going to misalign the incentives if they're based entirely on market prices. And let me give you a sense of what I mean by that. But first, let me tell you how we're getting at the cost data through what's called cost modeling. So cost modeling is essentially creating a stylized budget model for childcare providers combined with really local and really detailed input price data. And it allows you to evaluate the costs of the business over multiple scenarios. So in different market conditions with, say, different wages or different, facility types, different classroom composition, things like that. What a budget model does or a cost model does is first it accounts for the critical resources to production. So how do wage differences across the state impact the price of care? Second, it evaluates production costs. So you could use a cost model to say, are we able in Utah to sustain higher quality care if we wanted to make investments in the say educational or care value of our childcare providers. And then finally, it allows you to project any kind of changes in the system. Say the minimum wage is going to arise, or say the legislature is going to alter the caregiver to child ratios that are necessary in licensing. You could use a cost model to evaluate the impacts of those kinds of changes on prices. And our cost model is very, very local to Utah. Almost every level of the model is based on Utah specific data. So the parameters for the model come from the licensing requirements for the state and from the childcare quality framework that's established by the state, as well as direct survey data from providers and from childcare workers themselves. The input prices, how we know how much those elements cost, come from the BLS in the employer cost for employee compensation, or the OEWS, the Occupational Employment Wage Statistics, and from the BEA's regional price parity data. And then the assumptions of the model come from evidence about childcare decisions made by providers in their sort of cost-related survey data. So we have very local Utah data for that too. And all of this information kind of goes together to create a spreadsheet-based model that's really easy for providers or advocates or policymakers to manipulate in order to understand the variations in costs. And this model was developed in collaboration with the Office of Childcare and their advisory board. So it was really kind of validated and facilitated by the providers in the system. It's meant to be used by just about anybody who is interested in the question. So for example, if you were a provider and you were thinking about offering your employees healthcare, you could use this model to evaluate what that would do to your costs and how it would have to translate to prices. If you are an advocate in the area of childcare and you want to advocate for, say, publicly provided preschools or a system where childcare workers are valued at the same level as our elementary school workers, right, with higher wages and benefits, you could use the model for that. And then lastly, it was specifically designed for the purpose of meeting the agency's goals to set subsidy rates that enhance the stability of the system and support a higher quality care environment. So we have data in our model that's kind of specific to the provider type, center-based versus family-based versus, residential certificate, et cetera. to the quality rating that those providers have achieved, to the classroom ages and the composition of classrooms at the facility, and then finally to the region. And those are essentially the ingredients of the model that you put into the spreadsheet and kind of crank out locally reflective cost estimates. What we find in these estimates overall, and this is true, all across the country in childcare, is that personnel are 60 to 80% of the costs of childcare, which means that changes to those kinds of features are going to have a large impact on the estimated costs. And it also means that the cost of care isn't mitigated in the industry as a whole by any kinds of economies of scale, right? You can't scale up your facility level and see real cost savings by spreading your capital costs thinner, because the real cost driver are those personnel costs, and those ratios of caregivers to children are established in law. So you can't really beat that problem by scaling up. So, like prices, the cost of care vary with child age, but in this case, the costs are greater than the prices for the youngest and less than the prices for the oldest. So while the median cost of a care for a child under age 2 was about $1,100 to $1,200 in our price estimates, you see that the cost for the basic licensing standard level of care, which is this turquoise bar, is as high as $1,500 a month, right? At the same time, the costs or the prices for children in these school age groups were more like $700, and the costs behind them are about $500. What this means is that providers are constrained by the willingness to pay and ability to pay of the households that they serve, right? And households aren't able to pay the cost of providing care for an infant. And so what providers are doing instead is displacing those costs, what does that say, 5 minutes? On the less expensive older children, right? So in that sense, setting our subsidies based on prices is actually endangering care for these lower or higher priced, younger aged children, right? Because we're setting up an incentive system where you're paid based on your price and the price isn't enough. As a result, one of the things that we see often in childcare is a childcare facility that has 8 kids under age 2 and 60 kids in this 5-year-old, 6-year-old or school age group, right? Because that's how they are making up that cost deficit and maintaining a stable business, right? The idea is that you can use this cost data rather than the price data to set up those subsidies in order to incentivize the kind of care that you want to see in the market. And so that's one of the main findings of this. Another thing that you could get just from that relationship is that, if we wanted to set up all-day kindergarten, a free all-day preschool, publicly funded kind of scenario, we would be pulling out the kids that are making these businesses feasible and leaving them in a market where prices would have to rise even more, right? And so that kind of intervention would require even more commitment from the state. The other thing that you see in this graph is that the cost of care rises pretty dramatically with quality. So these are the quality ratings set in the state's quality ratings framework for childcare. Foundation of quality is the basic licensing standard, and then they move up from there. And as you can see, the cost of higher quality care gets pretty high pretty fast, with the highest quality ratings about 40% more expensive than the basic licensing standards. That means that the subsidies that we're setting aren't really giving access to this higher quality level of care. And it's also a reason why these higher quality levels are not kind of expanding rapidly in the market, right? They are a small percentage of the market. In the center-based facilities, they make up about 8% of the market, right? Because providers don't have an incentive to invest in quality if they can't recuperate those costs. Maybe I'll just show you one or two more things before I stop. The other thing we see is that costs are not that variable around the state. That a prior iteration of this cost model showed that there was a real variation in the cost of care driven by wages, especially high wages in the eastern non-metro region. But in the period since COVID, there's been an enormous wage compression at the bottom of the income distribution. So the lowest earning workers have seen their wages rise. It's actually the first reduction in inequality in the United States in 40 years. It's been pretty amazing. But the sort of market power of workers at the bottom has meant rising wages for those workers, but not much movement along the rest of the distribution. And as a result, it's really evened out the wages for childcare workers across Utah at about $15 an hour, right? Now for a job that's pretty stressful, pretty physical, pretty emotionally demanding, right? $15 an hour is not a lot of money. And so providers are having a hard time attracting and retaining workers to the industry when, you know, you could go make more money flipping burgers and leave at the end of the day without worrying about where the kids are going, right? But it has meant a kind of evening out across the geography. At the same time, we see that the costs are highest in Salt Lake and Provo, right? And lowest in Logan. But again, Salt Lake and Provo are some of the highest income areas in the state. And so the burden of childcare in those areas is not really driven by it. It's not as extreme as in other places. Okay, how am I done? Oh, well, I didn't get to the labor force portion. We actually have a really cool bit of data on childcare workers, because in 2022, the Office of Childcare and the Department of Workforce Services offered a $2,000 subsidy to anyone who could upload a pay stub or other evidence that they worked in the childcare industry. And this was specifically framed as recognition for their commitment during a period of great turmoil in the childcare world. But within that access to that bonus, you had to fill out a survey, and the survey specifically stated, this is about attracting and retaining workers in this field. And so there's a great deal of, well, there was, of course, almost universal representation in this data set as a result, because $2,000 is a pretty impressive incentive for filling out a 15-question survey. And so what we see in the workforce is evidence of how the labor force perceives their role in the childcare system, as well as what the labor force thinks are the most important elements for attracting and retaining workers. And it's pretty interesting, but I'll be pretty brief. As you can see, for the nation as a whole, you know, the quantity of people employed in childcare occupations declined really rapidly during COVID and still hasn't made up the difference. In Utah, that's not the case. We actually surpassed our pre-COVID employment level in 2022, maybe as a result of this bonus, maybe for other reasons, right? But we've maintained pretty high rates of care in the state overall. At the same time, childcare workers are at the very bottom end of the income distribution. These are occupations ranked by median income and median annual earnings, and childcare workers are below the 5th percentile of earners in Utah. But childcare workers look a lot like Utah in a lot of ways. They're more white, they're younger, they're more female, they're more Hispanic. So all of those kind of demographic elements make the childcare workforce stand out, but they're just about as likely to have a bachelor's degree or more. They're just about as likely to work full-time and year-round in their position. The distinction is they receive much lower wages than similarly positioned workers. So, for example, in the childcare workforce, at the time of this survey, the median wage was $15 an hour. That's probably still true today. About 60% were full-time year-round. In Utah, the median wage was $5 to $6 higher, and only 64% worked full-time year-round, right? But while in the Utah workforce overall, 80% of those full-time year-round workers had health insurance and, you know, other benefits associated with their job. That wasn't true for childcare workers, right? Similarly, one of the things I think is particularly interesting is that childcare workers are about 4 times more likely to be working multiple jobs, right? With 20% of childcare workers saying they hold an additional job all the time, and 10% more saying they hold an additional job some of the time. One of the sort of shocking things I found in this data was that childcare workers, only about 30% have paid sick days, which if you've ever had a kid in childcare, you know that that's a really important feature of childcare work. People get sick a lot, and those illnesses are passed around the facilities relatively rapidly. So being able to pull sick workers out of the workforce for a break to stop that sort of transmission can be really important. However, when asked, what would encourage others to join the career? What's your main motivation for working? The only people that mentioned, you know, I have this job because I have to support myself or support my family, or because I have, you know, financial reasons to be working in this job. The only people who mentioned money in this data said, well, we clearly don't do it for the money, right? All of the responses to this question were things like, I believe in the public goods aspects of childcare work, right? I'm here because of my ability to contribute to the future, to contribute to the individual well-being of children, because it is a rewarding job, because it's my calling, right? And that's the vast majority of answers to this question. Things that we commonly think of as economic drivers of childcare work, you know, people take this job because it's a job they can do while taking care of their own children, or because it has a flexible schedule and they get out of school when their kids get out of school, right? Or because they can be self-employed. Those really weren't the motivational factors driving these workers. Appealing to those sort of contributions to society, the labor of love elements of childcare was much more effective. Now, as an economist, I would say, yeah, but if you raise the wages, I mean, come on, you're going to draw in a greater supply, right? But the childcare workers were hesitant to make that statement themselves. And that could be either because they have some particular qualities that make them dedicated to this labor, and rewarding that kind of commitment would be in everyone's best interest, or maybe because there's a stigma associated with caring about money when your job is about caring with people, right? So there could be kind of either of those things. In either case, adequate wages for this workforce would both recognize the commitments that they're expressing here and encourage the kind of retention that we need in order to sustain the program. The problem is that, as we see in the cost data, neither the providers themselves nor the households can pay for that, right? So that would have to be a new type of public commitment. Okay, I'll stop there. Thank you.
All right, hi everyone. My name is Alicia McIntire and I'm with UDRC. Today I'll be presenting on RA17, our project on nursing pathways. So we kind of started out with a few different questions to guide this project. First, who's completing nursing credentials in Utah? And these are nursing programs all the way from CNA up through BSN. So these include everything from short certificates through 4-year degrees. So yeah, who's completing these credentials? How do they progress in their education? nursing is pretty unique in that it has this very clear pathway between nursing levels. And they all kind of stack on each other. Even recently, they started requiring that certain higher levels get the lower level certificates. So we're really interested in re-enrollment here. And then finally, what are their workforce outcomes? How many of them stay nurses, which we'll see here that varies pretty significantly depending on credential. As well as how long does it take them to find employment, what industries are they working in. So first we're going to talk a little bit about demographics of who is completing nursing credentials. So the largest portion of nursing graduates are graduating with CNAs. This is a nursing certificate, a certified nursing assistant. It includes a program, but importantly, it does not include taking a certification exam. So they're not taking the NCLEX, like there's no NCLEX associated with them. They are getting certified with the state. So they are licensed, but it's a different type of license. And then next we have LPNs. This is about a 1-year-long program, certificate program. And then associate degree in nursing 2-year program, and then finally a 4-year bachelor's in nursing. And yeah, CNAs are the most popular, and then associates of nursing, and then finally the last 2 are smaller ones. And part of the reason for this might be that the associate degree level are still considered registered nurses. That's kind of the lowest RN level. And that can open up more opportunities in the workforce. So as far as age, it kind of goes how you would expect. CNAs are much more likely to be younger, with their median age at 19 years old. And we actually have, like sometimes high school students will go through this program, so that drastically brings down the median age. And while they are majority in all of these cases, the majority identify as white, but it is, so we have like on the end there, you see the Utah demographics. It is particularly at the higher 3 levels, a little more likely to be white than the Utah population. And then when we get to LPN, ADN, and BSN, they're all more likely to be in their late 20s.
Question, do you know like what the average age for a bachelor's degree is in general? Like, is this higher or lower than we see in other programs?
Oh, that's a great question. I don't know.
That's
Oh,
okay.
but Brett does.
It's 25.
25. Okay. So yeah, I was just, the BSN was higher than I would expect, so that's interesting.
Yeah, I guess actually all 3 of them are higher than the average age for a bachelor's in Utah. Yeah, so and as we'll see, it might be influenced by the nursing pathway. That might be part of the reason why we kind of see those like higher ages, especially if they're like working through the pathway. Yeah, so we'll talk about that right now. So for progressing in the nursing education pathway, we looked at re-enrollment and further credentials, both in nursing and non-nursing, because some people would leave nursing and get a higher credential in something else. So here we kind of have a pathway. So we start at CNA, and this is to scale. So we have at the bottom our CNA grads, all of the CNA grads that were in the study, which included, I believe, 5 years of data. And then we see like a relatively small portion, stay a nurse after 5 years. And then there's a large chunk that exits. Also, another large portion that they never become a nurse, like they receive the credential, but they never appear in the wage data in a nursing related field. And then we have a portion that either never enters the workforce or never enters the Utah workforce. We used Department of Workforce Services for this data. And so we're mostly looking at W-2 employees. So the exit all category could include either private contractors or people who leave the state or people who leave the workforce completely. And then we have our re-enrolled category. So those are people who were at the end of the 5 years currently enrolled at the time this cross-section was taken. And then kind of go up to our LPNs, but you can see a sliver of light blue there. Those are people who got a CNA and then got an LPN. So once we go all the way up to BSN, we can see that a pretty large portion of BSN grads had either started as a CNA or they started at one of the other levels and then eventually re-enrolled and received a BSN. And then we didn't include LPN here, or it's not LPN, nurse practitioner. But because it was such a small group, but they also include a little bit from each of those. So this kind of gives you an idea of how many people are receiving one nursing credential and then going upward, as well as we do see some of them work their way up, get a later credential, and then exit nursing. That's what those larger bars are on the top of the ADN, but like the next largest one.
May I have a quick question?
Mhm.
So you indicated you use DWS data for this? You're not using wage data, right? I mean, what data are you using? I'm just trying to understand what DWS data you would have been using.
Yeah, we're using wage data.
Because wage data doesn't have occupational information in there.
Yeah, so we're using NAICS code. And
That's
we.
industry.
Mhm. So yeah, industry code, and we designated a certain number of industries to be.
So
Nursing related.
if they, as long as they were working in an industry, you're not really sure if they were sweeping floors or acting as a nurse?
Right,
Okay, just
right.
want to be clear, I
Yeah,
understood that.
yeah, so yeah, if they were working in a hospital, if they were working in education, because if you work for the University of Utah hospital system, it technically counts in the NAICS code for education. Yeah, so yeah, we're using wage data and going off of NAICS code, so it is not a perfect one-to-one relationship, but that's kind of a limitation that we have with the data. Yeah, so looking at re-enrollment, here we have the number of quarters to re-enrollment for each of the levels from CNA to BSN. And as we can see, those who re-enroll, particularly at the lower 3 levels, are re-enrolling pretty quickly. Especially LPNs, they're for them and ADNs, their median time to re-enrollment was 1 quarter. And then if we look at completion of the nursing ladder, that's quite different depending on the degree that they're in. So CNAs are highly unlikely to get a BSN if we're looking at the whole population of CNAs. This kind of makes sense with the previous slide that we saw because a large chunk of them are leaving nursing within 5 years, or never becoming a nurse. And then for LPN and ADN, about half of them are go on to later get a BSN. And then for BSN, about 12% of the people in this data became nurse practitioners. So there's definitely a wide variety of movement upward, depending on where some of these students start. CNAs were also the most likely to earn a non-nursing degree. And this could be anything, or any later credential that's not in nursing, about 21% of them. Whereas it's 5% or below for the other types of degrees. And for those that re-enrolled in something that was not nursing related, something in either the liberal arts or health professions, as defined by 2-digit zip code, were the most common degrees of study or areas of study. So looking at workforce outcomes, here we also wanted to understand their time to employment, as well as what industries they're working in. Again, this is NAICS code, so it's, we don't know exactly what job they had, but we can tell kind of the family of industries that they might be in. And we also wanted to understand their wage growth from 1 to 5 years out, as well as how many of them are staying in the profession. So this shows us time to employment. For all of them, they're getting employed pretty quickly. Like they're all getting employed, or their median employment time is within 3 months. This is a little bit longer for LPNs, but for many students, they're getting employed within maybe 0 months, like they might have an offer immediately upon graduation, or they're getting employed fairly quickly. With BSNs were the fastest, so they were had offers of employment or were employed in their field in 1 month post-graduation. So as far as industries, this also varies pretty significantly depending on the credential that one receives. So we can see here, see that very well. As someone moves up in nursing credential type or nursing credential level, they're more likely to be employed at a hospital. So as we can see here, BSNs are about half of them are employed at hospitals, versus about 15% for CNAs. And there's kind of an inverse relationship with that and residential care facilities. So CNAs are most likely to be in residential care, whereas BSNs are the least likely to be there. And then, also it says education. Again, this includes the University of Utah Health System, so that might actually be a hospital or a clinic, but because of how NAICS codes works at work, it's listed under education because it's a university hospital. Social assistance and administration are pretty low across the board, although slightly higher for CNAs. Let's move on to the next. So this is the wage data from 1 to 5 years for the students who stayed employed in Utah and stayed in nursing. And there's a pretty clear difference or pretty clear tier system as far as wages and wage growth from 1 to 5 years for all of these. So as we can see, wages for CNAs, even 5 years out, and even though there's decent, it seems like decent demand for CNAs, because they have such a high rate of turnover or high rate of leaving nursing, they're or leaving the workforce in general. But their wages are still relatively low, even 5 years out, they're only making a little bit over $20,000 a year. And then we see a pretty big jump for LPNs. They have the largest returns in terms of experience. Between 1 and 3 years, they see a pretty significant increase in their wages. And then ADNs and BSNs just start higher and see some wage growth, but not quite as significant as it is for the LPNs. Yeah, and like I said, that first year of workforce experience, LPNs see a 68% increase in their wages. But ADNs and BSNs are starting higher. So as far as exiting the profession, about 17% of the graduates in this study left nursing or were no longer employed in an industry that we associated with nursing via NAICS code after 5 years. And only about half of CNAs were still nurses 5 years later, which was pretty different to the other levels that saw less than 10% attrition. And 13% of CNA grads were never nurses, period. And we were talking about this a little bit, and this seems like it could be we don't exactly know the reason for this. That would need a little bit more study. But nursing is one of those fields where, for good reasons, kind of like with doctors and dentists, we don't necessarily let people practice a whole lot before they're licensed. Like they'll have clinicals and that kind of thing, but that really comes toward the end of their experience, right? And so, yeah, that could be part of the reason why, but they're experiencing nursing later. And that could be part of this, but again, that kind of needs more study. LPNs had the highest retention, but ADNs and BSNs were also pretty high. All of them above 90% of graduates stayed in nursing 5 years after graduation. And that is my presentation. I'll turn the time over to Connor. Sorry.
Good morning, everyone. My name is Connor Hill, and I am a researcher at the UDRC. This latest research that I am working on is part of our A series, which is our smaller research that we do. This research is particularly looking at state aid and if it helps retain out-of-state students. Your first question might be, how are you defining out-of-state students and state aid? We are considering graduates to be out of state if they did not receive their secondary award from a USBE institution. Unfortunately, the data doesn't provide where they come from, just that they did not graduate from a Utah school. Similarly, when we're defining state aid, UOSH's data defines that as New Century scholarships, region scholarships, and other state/local government aid. So that's a pretty big category that probably includes both merit and non-merit based aid. And it is worth noting that in this analysis, other aid and loan types aren't considered, so no federal or private aid. So we're really interested in this topic right now, especially as higher education is under the microscope. We are kind of considering how does investing in different populations impact Utah's workforce. A lot of research that analyzes state aid for students usually is around enrollment, whether it's keeping Utah students in Utah or bringing out of Utah students into Utah. A lot of the research doesn't have access to whether or not they stay in their location for workforce. Sometimes analyses will implicitly or explicitly say that. But being the UDRC, we do have that access, so we will be able to fill in that hole in terms of Utah's workforce. So this will set a baseline understanding as we go forward. So that brings us to the main research questions that I and UDRC were going into this for. First and foremost, does state aid help retain graduates in Utah workforce? We separate that between different demographic groups, but we're really going to be focusing on out-of-state graduates. Similarly, do out-of-state and USBE graduates have similar award proportion types, award type proportions? We want to see people, be able going into both bachelor's and associates, not just all USBE students going into associates, for example. And then lastly, because we are the UDRC, we have workforce data, so we're going to be looking at median wages after graduation in particular. So for this analysis, 3 data sources are used. USBE really just provides demographic data and then allowing a binary code to determine if they graduated from there. UG data provided, again, demographic data as well as if they actually graduated and then did not re-enroll, because we want people that graduate and then enter. And then the Department of Workforce Services provided wages up to 25 quarters before and after. So to be in this analysis, like I said, we wanted you to graduate and then enter the workforce and not re-enroll. And these are all for all students between 2012 and 2019. This graphic is for showing all graduates in those cohorts. Out-of-state individuals constitute about 2/3 of all graduates. That's not to say across all demographic groups, but in general. Okay, so there are 4 main findings that I want to highlight in this analysis. First and foremost, USBE and out-of-state graduates had similar mean aid, but out-of-state graduates median aid was substantially higher. State aid increased the likelihood out-of-state graduates were in Utah's workforce after graduating, though it's not equitable across all demographic groups and award types. Third, after graduating, out-of-state graduates consistently earn more than the USBE counterparts. And if we separate that even further, USBE no state aid women earned about $9,000 less than out-of-state graduate men 25 quarters after, so substantially less.
I have one question.
Yeah.
The median aid, was that because tuition is higher for out-of-state students?
That's a good question. I don't know. When we separate it by award type, that might point to it because, it'll be in the next slide, but I might be able to answer that a little bit more. So now when we separate it by people that did not receive state aid, this is going to be the vast majority of graduates. We do see, again, out-of-state individuals constitute about 2/3 of graduates at over 100,000 individuals. When we start separating it by different demographic groups, we see that proportionally, the 2 smallest USBE groups were BIPOC individuals, which is Black, Indigenous, and people of color, as well as graduate degree recipients, at about a 5-to-1 and a 10-to-1 ratio, respectively. There might be some explanation to graduate degree recipients in that there is a pretty big stigma if you go to your undergraduate institution and then you go to that for your postgraduate. There can be a bit of a stigma, so that can explain some of it, but for the other ones, perhaps not. Interestingly, USBE and USBE and out-of-state graduates, their closest award type were associate degree recipients, with USBE accounting for about 46%. When we go to people that received aid, we see that the numbers are a lot closer, and USB students were actually the majority of state aid recipients. Again, not in every category, but overall. As I was saying before, the mean aid was usually higher for USB graduates, this solid line at the bottom, but they're pretty comparable. When we start comparing the median aid to being the dotted lines, that's where it is vastly different. The two largest differences were again between BIPOC and graduate degree recipients, where out-of-state BIPOC graduates received about $4,800 more, and graduate degrees about $4,300 more. So again, a lot better. In order to examine the likelihood that they were in Utah's workforce after graduating, I used odds ratios. Just a quick overview, just so we're all on the same page. Odds ratios determines the likelihood that two things are correlated. If it is exactly 1, that means that they are independent. If it's above 1, that means it is positively correlated, negative, or below 1, negatively correlated. For this graph, the dark color will be for negative. So we see that when we only control for out-of-state and aid recipients, they're less likely to be in Utah's workforce. Though very interestingly, when we combine out-of-state and aid, it flips to the other side and they are more likely to be. I think one of the another interesting finding, let's say it that way, is that when we look at graduate degree recipients on their own, again, they're more likely to be in Utah's workforce up to 12 quarters after graduating. When we come down here to the very bottom and we control for out-of-state and aid, that again switches to less likely. This could be because bachelor degree recipients are the reference. And so it could be that the aid is referenced or is making it so bachelor degree recipients are more likely, but yes, it is interesting nonetheless. Next, we're going to be looking at median wage after graduating across some demographic groups. This first graph is going to be looking at men and women between out-of-state and Utah graduates. I think one of the interesting things is that generally speaking, men's quarterly income increased considerably after graduating, though women did not always see that, especially if we look at UofU women right here. Their wage growth is not comparable. Again, and that is when I was talking about over here, UofU no aid women earning $9,000 less than out-of-state men. And again, I think it's also worth recognizing that wages are grouped by out-of-state in Utah rather than by men, women, before and after. Or I guess not so much after right there, but looking at it by race and ethnicity, again, we do see very, very similar outcomes insofar as Utah and out-of-state graduates being coalesced together before and after graduating. Again, we do see that aid recipients see quite a bit of an income spike after graduating. And generally speaking, that does happen for no state aid graduates as well, but not to the same degree. And then lastly, when we're looking at wages by award type, again, very similar findings compared to the other ones, where certificate and associate degree recipients don't really have much of a median wage increase, whereas bachelor and graduate degree recipients do. I think it's interesting, again, it's not the first time that we've seen it, but for no state aid, bachelor and graduate degree recipients, when we see how they cross over, again, it's more reminiscent of, or excuse me, for that one in particular, it is coalescing more with award type rather than the out-of-state income. But the main takeaways from this really do highlight that state aid can help retain out-of-state graduates in Utah's workforce, though it's not consistent across all demographic groups. Out-of-state graduates receive substantially higher median pay despite being similar, but perhaps further investigation is needed. As well as further investigation is needed into the explanation of why out-of-state individuals consistently earn more than their USB counterparts, because unfortunately, this analysis doesn't delve into that.
So we're going to open this up for questions and answers now. This is for either of the two of those. Unfortunately, Catherine has to leave. I'm going to bring this microphone around just to better pick up the questions so that the recordings or the videos of this, anyone who watches it later on is able to hear the question. Last year, we didn't quite get some of the questions come through, so this is to address that. So I'll be walking around with the microphone for anyone with questions. If anyone has.
Yeah, I just want to be clear, what would the take-home message to the decision makers? What would that be at the end of the day when, above all the little details, maybe, or the high-level takeaway? This is my question.
For both of us, or?
Yours?
Yeah, for mine, I think when we're looking at investing into state aid, especially for out-of-state students, I think we still want to acknowledge the investment that is for that, because when we were looking at the high proportion of out-of-state graduates and what they constitute for our workforce, it's, I believe, important to make sure that those needs are still being met for those groups. So, yeah.
I have a question, actually. Could there be like a selection issue, like the students who come from out of state, are there like differences in their college readiness or anything like that that could also be correlated with their later wages?
Yeah, absolutely. I think there are many things that can be impacting what the wages are when we're looking at different demographic groups. Especially when we're talking about the self-selection there. I do think there is potentially an issue there, because there is an issue, or if we are bringing in people that do have high college readiness, it may be possible that they are more likely to earn higher wages or participate in other programs or at their post-secondary institution that may allow them to excel higher. I think what further investigation could probably look at into what programs they are going into. We don't really know if the proportion, if they're all going into business or teaching or whatever. So I think there are many questions as to what could be impacting wages between the groups.
Yeah, but you can't really control that, right? Like who comes into the state to be an out-of-state student, you really can't. I mean, vis-a-vis to the degree to which you can have like some sort of entry barrier to the state's education system, right? Which we don't really have necessarily, right? So like you have no way to create a bias towards that. So it's the more important thing is to understand who these individuals are, right? And like you've shown here that they tend to be maybe of potentially of higher college readiness. And that probably is some indication of their like workforce quality in the future. And if they're of higher workforce quality, then we should really put everything we can to ensure that we keep them, that we retain those individuals, right? Because it's like, instead of a brain drain situation, they are a brain contribution to our state. So.
My question's for Alicia. I was wondering, you said that, well, this is loud, sorry. You mentioned in passing, I think, that if nursing graduates don't stay in nursing, that they're likely to stay in healthcare or something else. I just wondered if you could elaborate on that at all. I just wouldn't expect that, like, CNAs particularly is a good entry for people going into lots of healthcare fields beyond nursing. So I didn't know if you were able to look into that at all, or if you have any commentary on other healthcare fields.
Yeah, so they were most likely to be in either, or the largest portion of them either stayed in healthcare, but or the biological sciences, but did something else that wasn't nursing. Or they kind of went to some of the degree programs that are just the largest in the liberal arts. But yeah, it did seem like they like a large portion of them at least stayed in healthcare or the biological sciences. Cause yeah, that, you know, they might not stay a nurse, but it could prepare them for, I don't know, something else like physical therapy or, you know, some other non-nursing part of the health field. But yeah, I think that was the second largest after the liberal arts.
May I ask a follow-on question? I get it out before he got here with the microphone. It's a simple follow-on. Dr. McIntire, thank you for your research. Darren Brush, Davis Technical College. I had exactly the same question. But when you looked at, I believe you said 21% of the CNAs go on to get a bachelor's degree, but I also may have misheard you. You said a secondary credential. Did you look at other post-secondary credentials or just bachelor's degree?
We looked at re-enrollment total, so all post-secondary.
Great, thank you.
Darren, do you have just a thought? Because, you know, Davis Tech, I'm certain has a CNA program, correct?
Very large one, yes.
Yeah. Do you have any flavor on what you saw in the relation to, you know, CNAs being sort of very different from the rest of the group of those individuals?
Yeah, I appreciate that. That's what triggered my question, Jeremiah. So thank you. So we also have an LPN program, and we also teach RN with Weber State. So we see that progression right on our campus, right? But CNA is the gateway program, not just to nursing. That's why I was interested more in the industry rather than just the occupation, because we see our CNAs go into surg tech. We see our CNAs then go into medical assisting. We see them go into, which are all certificate programs and not degree programs, which is why I was prompting the question, because they get that clinical experience in a very short amount of time. They get the exposure to the industry. They can determine if that's a field they want to continue in. And then they've got, you know, just on our campus, a number of different offerings where they can stack that credential.
Darren?
And you're saying that that's being expressed in the re-enrollment rate. I think that's what.
That's why I was asking, yeah, if it was capturing, because we're non-degree granting, are we capturing the higher ed certs that come with that?
And I'm curious, because I know you all have a very big concurrent enrollment program. What percentage of your CNA students are coming from Davis School District and getting that certificate of your overall enrollment? Do you know?
Well, I sit next to our Associate Vice President of Data who could answer that. He had time.
That to me also seems important to
It
that
is.
frame.
It's fine.
Yeah.
40% are in high school when they take CNA, 60% adults, like we do over 300 a year total.
Yeah.
And we're actually teaching it in some of the high schools too. So it's not just their programs. For instance, we teach at Clearfield, we teach at Morgan High.
Exactly.
And then they migrate back. Yeah.
Part of the motivation for my question too is my husband actually got his CNA at Davis Tech and then graduated from med school at the U. So he did like the physician route, but started with the CNA, which is really important to his path to to be a physician. And so I'd love to capture like those kinds of people.
And we'd like him in our alumni association.
Okay.
Yeah, so yeah, we didn't, so yeah, it would capture if they go on to medical assisting or something like that, yeah, it would be in the healthcare field. And this data is a little bit older, so it doesn't reflect some of the changes that a lot of the institutions have made to require CNA, like if you're getting an associate's or bachelor's, they require them to have a CNA as part of that program. So this was before some of those changes, so it's probably even higher now, that solidified pathway, because of that, because of requiring CNAs.
Thank you. Just a quick question for Alicia, if I may, is whether or not you had any interaction with the Health Workforce Advisory Committee or any of those who are working sort of on the industry side towards some of the objectives, I think, of those areas that you've studied. It might be a really good connection if you haven't, and I can give you some names.
Oh, okay, yeah, so Ari actually started this project and I finished it. Yeah, so he would be able to speak a little bit more about that to like the requesters and kind of their objective with this one. But yeah, I haven't had any contact with that committee, but I'm sure they'd be interested.
So we have Rick.
I was wondering if it was one we talked about before. Might be.
Yeah, the person that works over at Department of Commerce, what is their name? Eludes me right now.
You mean Jeff Shumway or?
Yeah, yes, that individual. So we've been in contact with him, and then we have also been in contact with, is it Ashley Moretz? Is that right?
Yes.
Yeah.
At Primary Care and Rural Health.
Yep, and that HWAC as well, which is what I think.
That's the connection I'm talking about.
Yeah,
Okay.
so our plan is to, when we publish this research, we will be communicating with them and inviting them to the presentation, as well as asking them if they want to do any sort of additional presentation.
Thank you.
That they're going to be hosting, yeah.
I have a quick question for Connor. You're right, this is loud. Do you think there's any relationship between the fact that typically if there is aid awarded to an out-of-state student, their, academic bona fides, if you will, are typically high performing, right? They probably have high GPA, high test scores, et cetera. Do you think there's any sort of a relationship? Because like that's what institutions would give aid. Those are the out-of-state students that institutions would give aid to.
Yeah, exactly. So most of the literature surrounding this topic usually talks about it being merit-based aid. I just didn't feel comfortable saying that just because we don't have like a direct definition on exactly what it is. So, but yes, you are right in that it most likely does include very high academic performing individuals.
Is that what you talk?
Hi, I had a question for Alicia. You mentioned briefly not including nurse practitioners in this research. I think it was because of the sample size or the availability of the data. Was that the only reason to not include them in this research, or were there other considerations to not include nurse practitioners here?
Yeah, well, I guess I should have been a little bit more clear. They were included in some parts. But for things like breaking them down demographically and that kind of thing, we started to run into sample size issues. But yeah, I don't know if it was just part of the request. They really wanted to know the pathway to BSN. But yeah, they were included in some parts, and you can like see that in the report, like how about 12% of BSNs go on to become nurse practitioners. But yeah, in some parts, they just couldn't be included because of small sample size.
I was wondering if the out of state, is that considered international at all? Do we have any data on international students?
Yeah, so it would include international students. When I first started getting this data or started this analysis, using UofU data, there is a column that does have international and depending on, chooses what, and has what state they originated from. It's just too messy and just didn't really make sense a lot of the time. So no, unfortunately, we're not able to pinpoint it that well.
But it is in there.
Yes, yes.
I had a question for Alicia also. So we were briefly surprised at the high age of the BSN recipients. I'm wondering, did you look at prior credentials earned by those students before the BSN? I'm wondering particularly for those students, how many were coming to nursing as a second career, right? So had a bachelor's in something else and then switched to nursing.
Yeah, we did look at their prior nursing credentials. So if you remember that like halfway bar graph, about half of them had received some other nursing credential beforehand. And some of them are returning pretty quickly. But yeah, it is possible that they're working a fair amount beforehand. I know that a number of the institutions specifically have like pathway programs for usually either for LPN to BSN or ADN to BSN. So yeah, a lot of them are earning other credentials beforehand. Because yeah, the number of like first-time nursing students who go straight into a BSN is actually probably pretty small compared to other four-year degrees. So yeah, it does seem to suggest that they're older either because they're changing careers or because they work in nursing for a while and then work their way up to BSN.
And so do you have a sense of how many might have had a bachelor's in business or psychology or something and it's complete shift for them?
Yeah, I don't have a sense of the like bachelor's to bachelor's transition, although I know that there are institutions that offer like a shortened BSN for maybe students. I know this because my brother-in-law did one of these programs. He did a bachelor's in exercise science and then did a shortened program for BSN because, you know, they're coming in with a lot of the prereqs already. But yeah, we didn't look at that bachelor's to bachelor's transition.
Great question, everyone. Thank you so much.
Thank you. So we have a break coming up, but actually before the break, I'm going to use a couple seconds while you're a captive audience to have Brittany Johnston, our Assistant Commissioner of User Experience, introduce you to a new product.
All right, I won't be long. Just a quick preview of our new data narrative that's coming out soon. Uses our new data narrative template. So if you've seen our past data narratives, we tend to use a scrolling style. We decided to try something different. So non-scrolling, just have everything on the screen. So this one is about the cost of living research that Connor did. So you'll see on the right, it'll provide an overview and the key findings. Here at the bottom right are links to the PDF report, the fact sheet, and a webinar video recording. And then this bottom left is the navigation bar that you'll see throughout. So for this one, we have 5 different data visualizations and then a glossary and limitations. So Connor did the research and I did these data visualizations, and this is all built within Tableau. So just a quick preview. So this first one is about median wages for UofU graduates. You see the filters here for education and race and ethnicity. And here on the right, you see the text has dynamically changed to share the key findings about median wages. The next one is about household budgets. And for this one, there's a heat map. There's actually a couple in this data narrative. So this one shows the percentage of graduates who could afford a certain county's cost of living. Again, this is income to budget, showing what graduates were expected to spend a percentage of their income on a household budget, and also their disposable income within a certain county. And again, you can filter it through year, household, gender, number of children up to 2, education level, and race and ethnicity. We have the same thing specifically just for income to rent. So what percentage of rent are they spending per county? And then the final visualization, this is about the allocation of income to household expenditures. So this is for single wage households. The donut ring on the left is for statewide all, the middle is for women, and then the next one is men. So a key finding of Connor's research was about how household size really affects this allocation of income. So for example, we want to show this in the visualization. So for state, we see here disposable 34%. For example, if I were to change it to 1 child, it changes to -8%, and childcare comes in at 30% that they're spending. This is for Salt Lake County. And if you go up to 2, childcare goes up to 55%, and disposable income -65%. So we have a lot of different variables in here that people can play with to see the differences by county or children and education. And then finally, we have this page for our data sources, our glossary and limitations, and how to reach Connor if you have more questions about the research. So that's a data narrative that should be coming out soon, and all of our future data narratives will use this similar style.
So how many deliverables does that make for each project? You've got an overall report, a fact sheet, and then this, and a webinar. So four deliverables per project?
Yeah, this is kind of part of our new engagement plan. So we want to create different products of the same research because we know like different people like to learn in different ways. So we're trying to, help provide more products that reach different people.
That looks great.
Thanks. So yeah, if you have any questions, you can talk to me after the break. Or during the break or after the event. So thank you.
Okay, well, break time, 10 minutes, and then don't leave. There's plenty of bagels out there, and there's more research going to come back. Thanks.
I asked that question, 20 years ago.
It's sacrificial labor. The first time I asked. We came up one vote short on the UI advisory. One vote short.
So it's what
It's unfortunate because.
Yeah, that's a brilliant idea. Why do you think it might help us so many ways?
We'll fix it before Tuesday.
Well, that's not gonna happen.
That's right, I forget, that's right, I forgot.
So it has, we've had.
Associate Vice President.
Yeah, I bet, because we're at some health research, I've been their director of research and evaluation there for.
That's cool. So you all worked 6 years?
Yeah, before that with Kristen up at Governor's.
Yeah.
That's right.
Yeah.
So that's last.
I moved on from Oregon.
Yeah, Aaron mentioned following your lead.
I forgot about it.
I saw the, maybe like you said, a PDF.
Members of the cabinet especially.
Yeah. I wasn't sure if I could build it on.
Is it difficult?
You moved?
This is actually just.
Yeah.
Yeah, so that's just
Years ago.
dashboard with the first text boxes. And then these are all icons over them.
Yeah.
Navigation
Yeah,
buttons,
it's
icons.
nice.
Yeah.
So how did you avoid having it in tab world? Seriously,
That's a good question.
I always want to get rid of that stuff.
Not recall.
You don't recall, how convenient.
My trade
Seriously, just-
secrets.
yeah,
You gotta pay me for that.
That's why, I mean. It can be distracting.
What's that tableau icon?
Yeah, because
I agree.
the people, especially people familiar with that, you want to do other things with it, they, you know, and.
Are we gonna see you?
Work, like the HTML. Really nice.
Are you talking about that bottom third?
Well,
Or even their
that
icon.
and just, this is, it's not one of the, links within Tableau or what do you?
On your computer.
So this is just, and then, so your Tableau doesn't start till you get down here, is that right?
No, that's all.
That's what I thought, right.
That's why I was able to knock this out.
Yeah, sure.
So the icons and
Very
the
nice.
words.
Count every kid it takes.
Oh, interesting.
So that way I had more.
I don't, yesterday I was.
Tell me how that worked. Do what? You built it. Sorry.
I'm glad you're.
I can send it to you.
How you know what you're up on your website.
Yeah, we make sure.
And the actually, and the grade system is probably.
Yeah, I'm pretty interested.
Burn enrollment.
Probably are too.
I
Yeah,
help out with other designs.
that's cool.
Yeah.
I'm from Utah, so I grew up in.
So what are you saying, that the icons at the bottom, you used an icon in the navigation option in the dashboard builder?
What did she do?
You had to use another bit of software to get text on it, is that what you're saying?
Motivation like.
Have you used?
I've never had it.
September.
She's the director.
Yes, he does.
Yeah, so just make sure we're saying the same thing. This is.
Yeah,
Almost 2 years. I dropped an image that I built.
right. Oh.
So Canva is like online design software,
Oh,
and then
cool.
most of it is free.
Yeah.
If you go and get a free account, and they have a lot of like options,
Okay.
graphics.
Cool. I need to lean into that.
So in Canva, I built just like.
She would have to be.
Have you ever been to the Tableau conference?
Don't leave us anytime soon, bro.
Yeah.
Don't leave us anytime soon, bro.
Well, I kind of suspect this might be the last year.
Yeah, I used
To go for that grant. And I don't know how that's.
Did you ever meet
gonna play
Melanie?
out. Yeah, we've been several years.
I was gonna do it
She has a countdown.
Yeah.
She would show me every once in a while. Like, Melanie, show me your countdown. It was like, I don't know, you know, like 10,000 days or whatever, you know, something like that, you know.
So they wanted to understand.
They just sorting out what I was gonna do. It's 3 full days.
No, it wasn't 10,000 days. It was like
Letting you like reserve a seat.
like 2,000 and something days.
It started with wait a month.
Yeah, yeah. You're supposed to get there 10 minutes. Yeah. it'll be like-
No, well, 30 years, 30 multiple, well, it's like 10,000 days.
You're 30 years. Also like how we got there.
There's a thing called.
I've been working for 3 years. But 15 years already. I have a head start. You know, we're about the same age. You know?
I'd never been to like.
So,
He said it's actually like. Took me a
I saw them.
That sort of thing. That's awesome. Thanks for turning on the camera.
Actually, that's right.
But that's not how it works.
Okay.
They provide a lot of design tools.
Yeah.
Start with that.
Yeah.
That's kind of how I guess.
Yeah, okay, so don't worry.
Thanks for showing me. That's kind of like what you're taking.
It's not working. That's not how.
Sure, yeah, I know. Well, you'll get it going quicker, yeah.
Only way that you can match.
Takes so long to get it recorded.
Yeah,
Yeah,
property, they're
that's
using
not-
the same pipeline.
Yeah. The same timeline for
So then yeah, their wages there too, yeah. They just, you know, obviously.
Well, there's, I guess, there's four, there's the one.
Oh, you mean like, go back, sorry. So there's four.
So there's about this opportunity. Like explanatory nature, because it gives you a chance to.
My guess is it'll probably.
Sure. Yeah, filter away, you know, yeah.
They're gonna try on these sides.
You did, yeah. That's cool.
Yeah, it's like everything in my row is really good. But on the other side.
Well, I just got
I'm at a conference.
I don't think anybody else is statewide, so.
They will be.
Yeah, but Daniel. Data for that, it should be, like you're saying, that it's
kind of
update the years of.
Yeah, the match.
The plan is.
Oh, yeah, that's cool.
I liked it.
I mean, it was here,
Oh, yeah, so that. So my guess is they'll probably. Yeah, probably like me and Mary. For a week, I guess. So probably like second.
All 16 public
It's good to see that.
So yeah, ready. So you might be able to just write it without having to, so you can share.
People did a lot of stuff.
So this is a form of verifying. We need to, you guys can share.
Yeah.
That's the. I told that.
Somebody, no, I will try.
Yeah, it seems like, but since we don't have it, yeah, it's probably around.
Yes, just forward it to majority of people, and then I'll ask Jenny about it, and if he needs to see her, I'll look at that. Yeah, I'll get to you tomorrow, so I'm guessing he's gonna fit her in, but I'm hoping it's 30. So it's fun.
But that doesn't have one of the.
Yes, I will ask them.
So like Chris would count.
Similar, yeah. Okay, no problem, thanks, Colleen. Yep.
So this one, Ben says it's like a ship that I'm like hop in there on a call, it makes sense, you know, like, because sometimes start, like, you guys are in Maryland or on the coast. Yeah, I see what I mean, so it'll be like, what's their favorite parts? That's it, yeah, the high school, so that's something that's using.
The bridge. Yes, I think.
Yeah, because it's years of age.
Yeah, so she's retired. Yeah.
Oh, shade, okay, slightly separate. They overlap for like 1 year, but it's actually. So it's like the newest.
I think. Maybe they don't have that.
I don't think so.
Oh, I don't know. Yeah, Gary doesn't have it.
That's why.
She's the cute.
I have to make it. Yeah. Glad it's not the one.
So I guess like 28 people.
Yeah, yeah, the A2 program.
You get pushback from.
Some idea of how many schools. No.
I don't know.
Yeah, exactly. Or like some legislature it's about what this part. And we really care about it, you know, because. So yeah.
I would.
Yeah, they were like.
Yeah, that's great. Then the other.
They were like, yeah, we can do it on our side.
You might see more people.
I'm assigned to a different person.
Friends.
Uh-huh.
It'll be nice. I mean, your plans to be.
Yeah.
Thanks, guys.
It'll be nice to have everyone.
I've got a lot of.
Meetings.
Yeah, that one actually got
Managers.
One of the years we split.
I don't have.
Back to my meetings on Tuesdays. Are like in something, it's not all implementation, it's just so much. Issues to start.
It's too early to say, but they're all.
But like.
I think everyone's on. Yeah. So for Ben, it's like he's running like an hour and a half, 2 hour gauntlet.
Mine tend to go long. I think because I don't have somebody.
Yeah, and Michael's is at the very end.
So it's probably.
Yeah.
Yeah.
But I asked.
So yeah, that was a component that got in. Yeah, like we don't need.
We don't need.
Oh, like all this doesn't matter, I didn't know. Yeah. What is nice, so much more. Yeah. And did you, it's very nice of you, but yeah, don't worry about it, I don't mind hearing you. Okay, cool. And you gotta be. Yeah, I got all of it. That's, I did my bachelor's, I mean, educational measurement. Yeah, like, it's didn't know it existed. It might be until.
More energy.
But yeah, I got my undergrad and master's.
That's my. It's right now.
I'm kind of, sorry, I'm just sort of like.
Yeah. What?
A couple hours.
Yeah.
It's probably so.
Yeah. Yes, yes. Hey.
Stay in economics and value doesn't have to. Yeah. Postsecondary.
Okay, thank you, everyone. I believe this is only a couple minutes late, which is good, I think, for this type of thing. So this is gonna be our second session. We're going to have, I'm gonna be presenting one of our other researchers' work who's on vacation today, unfortunately schedules and conflicts. So I will do my best to represent it well. Then we have Andrea Brandley of the Gardner Policy Institute, and we have Brett Campbell of UofU presenting as well in this session. So I'm going to present Karen Tao's research on post-secondary and workforce outcomes for charter high school students in Utah. So I should be able to answer most questions when it comes time to this. I will be brutally honest, if there is something that I just am not quite familiar with enough, I did bring the paper just in case. I've read through it many times of the peer review process, code review. So as I said, I do know this, but I think as researchers, we all know sometimes you're never quite as intimate with the work as when you're actually completing it. So I hope to represent it well. So brief background on charter schools. Charter schools were designed kind of as a way to improve student learning through innovative teaching methods. Basically what a charter school has is a little more autonomy than our traditional schools that we're used to. And in exchange for this autonomy, the goal is that these charter schools come up with some sort of way, either through educators, through other staff, through administration, to come up with ways to maybe address some potential educational issues. I believe in 1998 is when this really took off in Utah. And the goal is, again, to either lead to better student outcomes or for some cases, to give additional choice to the parents of students of where or what type of school their student is learning from. By 2023, when you might have to correct me on this one, the State Charter School Board oversaw 126 charter schools. And it was serving 78,732 students. I'm just gonna round that up to 79,000 for the rest of this. It's quicker to say. 12.3% of students, about 82,000 were enrolled in charter schools in the 2025 school year. We're expected to be enrolled in the 2025 school year. So the year that we're just talking, or that's currently in session. And so we see year over year growth just between 2023 and 2025. We've seen growth kind of since the beginning of our data of people in, or of students in charter schools. So our questions are, we want to know, are charter schools able to come up, or how are charter schools comparing to our traditional schools? And so to do this, we want to say, are there any differences between charter schools and non-charter schools? We're going to specifically look at high school students because this is a way for us to use UDRC's capability of matching individuals from K-12 to post-secondary to workforce. So we're specifically asking about those who graduate from a USBE high school. And we're looking at then other differences, or we're saying, are there differences in USHE? So that's the public degree granting institution tech colleges, in enrollment and completion. So we have our charter school students, our non-charter school students. First question, is there even a difference between public post-secondary enrollment in Utah and completion? Then we want to start to really quantify these differences rather than a binary yes or no. What about time to entering? So they complete USBE or they graduate secondary, and then we see them enroll in a post-secondary institution. Are there differences in how long that takes? Why that might matter? The earlier you're able to get into a post-secondary institution, the quicker you can graduate, all else being equal, and then enter the labor market with some sort of credential that tends to lead to higher wages or more employability. So that's why time to enrollment is important. Then we also care about time to completion. We've already mentioned post-secondary credentials are associated with better labor market outcomes. The sooner you get those, the sooner you can start those labor market outcomes. As we all know, most of us need a job to survive. Some of us like to have jobs where we can do more than survive. And that's why we're concerned about these post-secondary questions. What happens then in the workforce? We look at workforce participation. So that's, are they showing up in these workforce numbers? Are they strongly attached to labor force? I'll define that term in a bit. And then what about wage differences? Are they in earning wages that are different, or are charter school students and non-charter school students earning wages that are different? So we really are then going to be able to quantify what relationship between attending a charter high school and post-secondary workforce and USHE outcomes. This fourth one's on here because we're going to go more than look at just the simple averages. We're going to try to use some methods that can hopefully slightly pin down a little bit more of that charter school, non-charter school relationship. So who are we looking at? We looked at about 426,000 USBE students between the years 2012 and 2021. So some of these students aren't going to be unfortunately included in our labor market portion, as we're unable to match directly from USBE to DWS, the wage data. About 11.5% of those were charter school students, 49,000 were charter school, 377,000 were attended a non-charter school. So what we're going to do for this presentation, when we call someone a charter school student, means that they ever enrolled at a charter school between grades 9 and 12. We do in the paper look at this a little bit more intensely. We're looking at how much they were enrolled in charter schools. For the sake of brevity, we won't get into really some of those differences, and we're just looking at the binary. Did they attend a charter school or did they not attend a charter school? So for this, when I say a charter school student, it means they showed up, enrolled at a school that from USBE is flagged as a charter school. So again, Utah State Board of Education's data, USBE, we're bringing in these demographic factors that they have. We're looking at some other factors as well, whether or not they're an English language learner. This is gonna matter for both into post-secondary and potentially post-secondary success as well. Free and reduced school lunch. This is kind of our low income indicator. AP and concurrent enrollment credits. So are they coming into UofU prepared? And then whether or not they even graduated from a high school. We see that some of these demographic factors are already kind of linked with disparate post-secondary and workforce outcomes. So we're going to want to be able to control for those. That's part of the reason why we have those on there. From UofU, we look at enrollment. This is just a binary. Did they ever pop up in the records of any of the UofU institutions? We're going to look at their grade point average upon graduating or at their final semester if they didn't graduate. Graduation, this is just a binary. Did they complete at least one award from a UofU institution? We're going to look at their degree levels, so certificate, associates, bachelor's, master's. And then we're going to look at that time to degree completion. For this one, we have the quarter that they, or excuse me, the term that they enrolled in. We have their first enrollment term and then their final graduation term. And we're able to look at it that way. And then from Department of Workforce Services, this is the quarterly wage data. I know some of our DWS economists can explain this better than I would, but basically what it is, it's not every firm in Utah is paying into this. There are some federal, some nonprofits that are not included in this. So barring selection into those jobs that are not covered by this unemployment insurance, being co-determined with charter school, it still is a pretty good way to understand, is someone employed and what wages are they making? So 4 key findings. We find that a lower percentage of charter high school students graduated high school. Among the high school graduates, so we're taking that subset, the ones who did graduate, a lower percentage of charter high school students enrolled in a UofU institution. Among the UofU enrollees, so this is now a subset of that subset, a lower percentage of charter high school students aren't earned any award at a UofU institution. With that said, for those charter high school students who went to UofU, we see that they actually enroll sooner and they complete sooner at those UofU institutions than those non-charter high school students. A lower percentage of those charter high school students ended up in Utah's workforce, or at least a subset that we're able to observe of Utah's workforce, and they earned lower average annual wages than their non-charter peers. Then we find with a little bit more advanced techniques that attending a charter high school is associated with lower post-secondary enrollment, graduation rates, and decreased probability of strong workforce attachment. So some of these headline numbers first. On the top, we have those in the creamish color. We have those who ever attended a charter school. On the bottom, we have those who never attended a charter school. So high school graduation, 83% of those charter students graduated, whereas 88% of our non-charter students graduated. On the other kind of side of the differences, we see that on average, those who attended a charter school had 2.8 average AP credits, as opposed to the 1.4 for those who did not attend a charter school. Concurrent enrollment, we see there's about 45 credits for the charter school student and 22 for the non-charter school student. So this kind of fits with those other findings that we had, where we're seeing a mixed bag for the charter, non-charter.
Yeah, just a quick question for AP and CE. Are we talking, so for the 45 concurrent credits earned, is that of individuals that earn concurrent enrollment, or is that all charter?
Let me get back to you in the question section for that. Thank you.
All right, is that all years or just like a sub, like 1 year? Is that are those averages for all of across all the years?
So yeah, this is the whole 2012 through 2021. And look at USHE enrollment and USHE graduation. Again, charter schools are in the cream, non-charter schools are in the light blue. We see 36% enrolled at a USHE institution as opposed to 43% of the non-charter school students. Of those ones who enrolled, 1 out of 4 completed a USHE award of the charter school students. Basically, 1 out of 3 of the non-charter school students completed any USHE award. So again, this is anything from certificate to bachelor. There probably are going to be a couple graduate degrees in there from those earlier classes. So time to USHE enrollment. On average, our charter school students enrolled at a degree granting institution. So this is any of the degree granting institutions, the universities whose mission is either a regional or research institution. We're seeing that it takes about 8 months for a charter school student to graduate and then end up in those USHE records. Whereas it takes about 9 months for our non-charter school students to end up. So it is a month. It is different from a lifetime earnings perspective. Doesn't make a difference. We're not sure. We can't answer that specifically, but that difference of 1 month does exist. For our tech colleges, we're seeing it takes about 12 months for our charter school students to enroll. For our non-charter school students, it's taking about 16 months for them to enroll. For those who aren't familiar with the technical colleges, some of their certificates you can earn in about those 4 months. So I think that is significant from both a statistical standpoint and then from a, does this potentially matter for later on questions? So that's a third of a year that we're seeing difference between charter and charter and non-charter school students at the technical colleges. Yeah. Completion. So charter school students we're going to have on the left, non-charter school students we're going to have on the right on these. Except for this one, it's on the right. Shouldn't have been looking at that one, I apologize. So for our charter school students, they're earning an associate's degree, it takes about 27 months. For our non-charter school students, it takes about 31 months on average to earn an associate degree. Ideally, an associate degree is 4 semesters, 2 years. So again, we're seeing almost half a year difference here. So that may be a materially important difference between our charter and our non-charter school students. For bachelor's degrees, we're seeing that our charter school students are completing in about 46 months, whereas it's taking about 52 months for our non-charter school students. So this is half a year. And again, this is a non-trivial amount of time, but maybe this result isn't too surprising given those differences between concurrent enrollment and AP credits that we see for our charter versus our non-charter school students. So workforce attachment. First question just is, do they ever earn wages in our DWS data? And this is a subset of all wages earned in Utah, but it's a pretty good chunk of that. We're going to see that 50% of our charter school students have wages as compared to the 58% of our non-charter school students. So the first year after leaving education, we see 43% of charter school students have wages, and then 50% of our non-charter school students have wages. So those numbers increase after that initial year for both. But it does take, it seems a little bit longer. We don't know, we don't have a reason why. We just know that it's what bears out that the charter school students aren't in the labor market as quickly as some of their non-charter peers. Then we want to look at those who are strongly attached. We're considering strongly attached means that they earned wages for all 4 quarters in a year. And those wages were at least as much as working full-time at a minimum wage position. Since unfortunately we don't have access to hourly earnings or an hourly wage, we only have a lump sum every quarter. This is the best approximation we're able to do for strongly attached right now. We see that 10% of our charter school students are strongly attached that first year, whereas 14% of our non-charter school students are strongly attached. So again, that same difference where non-charter school students are having a bit, are seeing more intensity in the labor market than our non-charter school students. These participation rates actually decrease in time for both of these groups. And that's not necessarily something that it's something that we do kind of expect to see. It bears out in all of our data. Some of this is family formation. Some people choose to leave the labor market. Some people may choose to work part-time as opposed to full-time. The part-time, full-time is something that we're never able to, one, truly get to, but also we don't judge this as a good thing or a bad thing. We don't know if it's a personal choice. We saw how expensive childcare was about an hour ago. It may make more sense to work part-time and take care of the children part-time, but it also may be something that they're only able to find part-time work. So it's a mixed bag, and we don't do this as any sort of a judgment in that case. But we do expect that attachment rate to decrease a little bit as we go years further from graduation. So average wages, I swear there's a third line right under the yellow one. That's going to be all of our students. The darker gray line is going to be our charter school students, and then the gold line is going to be our non-charter school students. And we see, so all the students who have wages, this one, the first year, we see about $15,000 a year average for our charter school students, and about $16,000 for our non-charter school students. And for those who earned any wage, this is both strongly attached and non-strongly attached. We see that over the course of 5 years that we're able to observe them, that gap barely closes. When we move to those who are strongly attached, on this next slide, that first year, aside from earning a substantial amount more than those who weren't necessarily strongly attached, that gap is also smaller. It's, if I remember exactly, it's just under $1,000 as opposed to just over $1,000. And what's interesting is we see that gap close by the 5th year. So we have that initial difference between charter and non-charter school students, but those wages catch up for the charter school students by the 5th year after they graduate. And then this is taking all cohorts for which we're able to look at 5 years worth of data. And then we set them kind of on a relative time frame so that 2012 and 2013 are able to be overlapped. And then as well, this is inflation adjusted wages. So we don't have, potentially 2012 dragging everything down while 2015 wouldn't be. Next, and what I don't show here, but I'm going to get into, is we see distinct demographic differences for those earlier cohorts I was just mentioning between the charter and the non-charter school students. The charter school students are more likely to be white, less likely to be low income or ELL. So all of those tend to, previous research, UDRC, USHE, other academic sources have shown, those are groups that tend to complete quicker, enroll quicker, and have higher wages in the labor market. So even though we're seeing some of these differences in outcomes, we want to know, is this, we're never going to be able to causally attribute what I'm going to show to charter schools, but we can say we've tried to narrow this down by comparing more like subjects to look at how those differences happen. To do that, we use inverse probability weighting. To do this, I'm going to quickly gloss over this. I have about 2 minutes. We basically say people who look like charter school students but end up at non-charter schools, we're going to take their outcomes a little more. We're going to give higher weight to their outcomes for talking about non-charter school students. And for those who look like non-charter school students but end up in a charter schools, we're going to say we're gonna give these guys a little bit more weight when we're talking about charter school outcomes, because they might be more representative of what a charter school is actually doing. Again, this is not going to be a causal effect, but I am gonna still call them average treatment effects for ease, but don't take effect causally, rather as a ease of explanation. And then I can go over that in the question section. Brett's also gonna cover it. Maybe it's better this time. So I'm even gonna skip this part completely. So looking at the average treatment effects for post-secondary outcomes, we still find that our charter school students have lower post-secondary enrollment, lower post-secondary graduation. We tend to think of these as bad outcomes because we've explained already, and lots of pages of ink have been spilled to show why post-secondary credentials are good for labor market outcomes. We still have a down arrow for months to post-secondary enrollment. This time it's good. We still see that difference, that quicker enrollment at UofU institutions. Not covered, we see a lower UofU GPA. So even though they're getting in there quicker and they're getting out quicker, showed next, the charter school students aren't performing as measured by GPA, quite the same as their non-charter school peers. We also see similar outcomes to previously for our labor market. We see this is the difference in wages. We see that difference, but then that catch up that we saw in the graphs. It still ends up, once we weight these outcomes differently, for those all wage earners, we don't see that catch up. It's about $800. We still don't actually see that convergence in wages. Once we do this weighting, we see a larger initial gap than initially, and then we don't see that convergence between the two. There still is a couple $100 gap. I'll leave you to decide if that, over a year, a couple $100 matters, but it is a difference, and it is, significant from a statistical sense. Thank you.
All right, thank you. I'm Brett Campbell from the Utah System of Higher Education. And we're going to talk about concurrent enrollment, which is the opportunity for high school students to earn college credit while they're still in high school. Also known as dual enrollment, because they get college credit and high school credit at the same time.
It's thanking you fortune, just so you know, and father.
Yeah, it is, because it's what, $5 a credit, so. Ooh, I got excited. Okay, so of the examples we have, of the objectives we have, there are 5 questions I'm going to go over, fairly quickly. And there's a lot more in the report when it's available. So we're looking at how does the completion of concurrent enrollment courses affect degrees earned? How do student demographics work in that, and how do the institutional characteristics also? By institutional characteristics, we're looking at degree granting institutions, and they are broken into 3 categories by UofU, which is research institutions, which is the U and Utah State, regional institutions, and then our 2 community colleges. One of our stakeholders wanted to know the impact of online versus in person. I may say face-to-face, but I mean in person. It's an old tech term. And then could we optimize the CE pathway to maximize earning or retaining degrees or other credentials? Every year we get a high school graduate file from USBE. So I took those years took that file for cohorts 2015, 16, and 17, then went back and looked at the concurrent enrollment courses those students took, and then tracked them through post-secondary education up to 6 years. So we had over 54,000 participants, 83% of the high school graduates were white, 10% Latinx, 7% were BIPOC, at 20% were identified as low income using the free and reduced lunch flag that USB provides. Okay. Just briefly in terms of what was going on with these students, I see here, almost 50% of all high school students in these three cohorts took at least one concurrent enrollment course. 73 took general education. And the two big ones that I'm going to talk about are composition, which is English 1010 or English 1020 for those who really want to know that kind of stuff. And then 40% took quantitative literacy, which is a fancy way of saying a math. And to receive the quantitative literacy, meet the requirement for QL is if you have to take math 1030 or higher. So on average, students left high school with about 8 credits of as entering a college, and that equates to approximately 3 concurrent enrollment courses. One of the findings linking this is that most, as I talked briefly about enrollment, is that most concurrent enrollment students enrolled in a 4-year institution. So we did a previous study on the effect of concurrent enrollment on post-secondary enrollment. If you do concurrent courses, you're more likely to enroll. So this is just kind of I'm not going to talk too much about that, just to say that 40% of concurrent enrollment students attended, moved on, 72% as freshmen. I mean, you only took 8 credits, so it's not likely to move them that much forward. 25% of sophomores and 3% as juniors. And then overall, we had 40% earning associate, 44 as bachelors. These include double counts. 75% enrolled as full-time students and 25 as part-time. Okay, so that's the background information. In terms of looking at degree attainment, we're providing comparisons here where the blue is the concurrent enrollment and green are those who are not participants. These are total attainment counts. So we're looking at, I should have played around with this. So this will equal up to 100%, give or take rounding error. So 49% of all graduates are female students who also took concurrent enrollment courses in high school. Of all of these graduates, 15% were low income. So 85% were not. So 11%, or I should say 2/3 of those low income students, well, a little bit more, were concurrent enrollment students. So you can see 11.4% there. Looking at race and ethnicity, again, the same thing, these all add up. So 86% of all graduates were white, with 68% of those being concurrent enrollment. We have no graduation data on Native American students. If we could get them in concurrent enrollment, that was the win. But if they did that, we weren't able to move them through the process. So looking at by institution, we can see that 80% of concurrent enrollments went to a university, compared to 66 for those who are non-students. So we have slightly more non-concurrent enrollment attending our community colleges, with a large proportion of those concurrent enrollment students going to regional institutions. I mean, they're more represented in the non-concurrent in research too, but half of them are attending those regional institutions. Okay. Now the part that already delegated to me. We did me and myself did regression models. So we did a form of matching called inverse probability weighting, which can compensate for some errors or bias in your data. So as Ari did point out, you start off with matching through propensity score matching. In this case, My two groups were concurrent enrollment and non-concurrent, or non-participants. We matched on gender, race, ethnicity, high school low income status, which is free reduced lunch, and high school GPA. So then after we matched that, then we created the weight, which added a degree of bias for each student. Larger weights were assigned to those less likely to graduate from college and then, yeah, okay. Downweighted for those who were more likely to graduate. So then we created all those weights and we assigned them and provided our two groups. So this is a logistic regression. So we want to, in this case, we're trying to predict were they able to graduate or not by all these variables. There's so many variables, it takes up 2 slides. So the only 2 things I want to point out, obviously, well, low income is a reducer. Obviously, you're less likely to. The more courses that you can take, the more likely you're going to earn a degree. There isn't a max. It's a linear upward trend. So we were predicting that there would be a maximum number of courses to take, and that didn't show up in the data. The other one, just to address that last question, is in-person versus online. In terms of bachelor's, it was positive, but it wasn't for, so it was the opposite effect for associate degrees. And generally, students were likely to enroll in face-to-face courses. 86% of the courses were face-to-face. And then in a minute, I will discuss that actually one of the second sets of regression looked at time to completion. Okay, the second one we'll just show right here is in terms of which courses that took to predict graduation. So this is based off, since most courses are general education that are taken in high school, we looked at the main core categories. So there's 2 composition courses, the one quantitative literacy, life sciences, physical science, and foreign language used to be tied into scholarships. And there was some previous research saying that foreign languages would predict graduation, and that's not the case. 2 positives: taking your English 1010, 1020 leads to greater graduation. Completing that quantitative literacy in high school leads to predicts graduation. Taking a life science course didn't. It was their suppressor. You're less likely to graduate. So we don't have any high school counselors here. And then taking physical, one of the questions I was asked previously is kind of what would I recommend? I'm like, do the 2 comp courses, do quantitative literacy, and if they still have gumption, put them in physical sciences instead. And I'm sure taking college level physics and chemistry may not be something you want to look at, but apparently it's better than biology.
What was your time? I'm sorry, I should know this, but I don't. What was your time horizon for looking at graduation?
6 years.
Huh?
6 years from graduation.
Oh,
high school graduation.
Just kidding. My theory does not stand to that then. Well, I was just thinking like maybe if you're the type of person that takes life sciences, you're gonna go and do a degree that takes longer than 6 years to get. And so therefore it doesn't look like because of your shadow of your data, right? Whereas if you're doing composition and quantitative literacy, you're more likely to just take the approach of just taking a general education, degree. And so like you can get that done within 4 years or what have you. But it's an associate's degree, so it's only 2 years. Oh, these are people who actually graduated, right?
Yeah, it's predicted whether they would or not, so.
So those top 2 are English, basically, the composition and quantitative literacy.
Right.
Those are English.
Yeah, so those are promoted graduation.
This wrecks my brain.
Okay. Okay.
I mean, physical science and foreign languages those are not statistically significant for the associates or the bachelors, so I'm less concerned about that one, but life science makes no sense to me.
Well, the thing that upsets me about life sciences, I took introduction biology in high school. I did very well, so. That's all I did really, but.
I did good.
Physical sciences, I mean, most of those physical sciences are prereqs for engineering, which is a really long degree.
That's true, right?
So like.
Right,
Why was
that's
that?
what he was leaning into was the engineering, so, or, being waitlisted in there or something, so.
I'm curious.
So this is a standard regression. We're looking at time to completion. So this is months. Concurrent enrollment students earned an associate degree 7 months faster than non-participants. And then the concurrent enrollment students who gained a bachelor's degree earned their staff 5 months faster than non-participants. Again, so we see that, what this is really interesting in terms of if you know the university or the degree granting institution, most enrollees and graduates tend to be white females, but in this case, being male accelerates in degree attainment. So point that out. And then.
Sorry, could you restate what you just said about being male and time to completion?
Concurrent enrollment promotes
Okay.
earning a degree faster for
Okay.
male students.
There was an interaction.
No, I didn't look at any interactions.
Okay, so concurrent enrollment overall speeds up time to completion.
Yes.
And male students are slower in general, but we don't have an interaction there.
So, yeah. Real brief, Tim, you were asking,
If what the F at the bottom of the other slide meant, is that female? Like,
no, that's an F task, just to
Okay,
compare
that-
models for people like me who like to run lots of models. So. Looking at timely completion, I want to say time, that means something very specific at USPD. Looking at time to completion. This is mean time measured in months. Again, just a reminder that students in high school only took 3 courses, so we're expecting to leapfrog too much, or 8 credit hours. So here we see about 8 months difference for community college, 6 for regional, and 5 for research institutions between when they earn and when they not earn. Why community college and regional is so close to the other ones when it's a 2 years or 4 years, that most of our community college students enroll part-time because they have jobs and other things to take care of there. One thought in why this occurs in terms of why they are able to move this much faster, which is 1 to 2 semesters, is that while it's not giving them a head start in the number of credits earned, it creates their expectations, sets them, and kind of builds that work ethic that they need. So just to summarize, participation in current enrollment has differential effects depending on student demographics. It's wonderful for certain students over others, meaning mostly the Black, Indigenous students and those students of color at least likely to benefit from concurrent enrollment. This is counter to the literature that says specifically Black students really benefit from concurrent enrollment. Institutional characteristics, we see differences by that in terms of which ones they are going to enroll in and which ones they're going to graduate from. And then of course, differences by award type. I didn't get too much into that, but there's a report you can download. So. Anyway, thank you.
Hello, everyone. I know we are near the end of the day, so I will try to speak fairly quickly and get you all on to the rest of your day. My name's Andrea Brandley. I'm the Senior Education Analyst at the Gardner Policy Institute. And I took a different route than I'd originally planned for this presentation. I bug our UDRC friends often, and they share lots of data with me. And I actually have like 3 reports currently in process using their data, but none of them were really ready to share. So I'm sharing different research today. If I'm lucky enough to be invited back next year, I will share research that utilizes data that the Utah Data Research Center provided for me. So I'm gonna just talk about three different reports that we've released in the last 6 months-ish at the Gardner Institute. For those of you not familiar with the Gardner Policy Institute, we focus on economic, demographic, and public policy research to try to help Utah's decision makers make informed decisions. That's our tagline that we shout out everywhere. So I'm going to talk about three things. Utah's demographic dip is the first, the benefits of higher education, and then a series that we've been doing rapidly in the last 6 weeks or so on the Utah federal government nexus, just highlighting economic linkages between Utah and the federal government to help people understand what potential changes could have on Utah. So I'll start with Utah's demographic dip. I included this just to highlight that I had a couple co-authors on this work. Heidi Pryor is our public policy analyst on our demographic team. I believe she actually presented at Bagels and Research last year, so you may have seen her. And then Phil Dean is our chief economist and leads our public finance work at the Gardner Institute. So to start, I'm sure many of you, especially those of you that work in higher education, have heard the term demographic cliff. This has been going around for the past several years. As you can see in all of these media headlines, you know, the demographic cliff is coming, spike in college closures. Why are so many colleges closing? Lots of hype, I would say, about this topic. And what they are referring to essentially is this. So this is showing Census Bureau's projections of the college age population, ages 18 to 24, from 2024 to 2060. So you can see that the college age population peaks in 2024 and then is projected to decline every year for the next 20 years, and then remain relatively flat through 2060, declining by about 3.5 million residents. At the Gardner Institute, we sometimes tease on the term cliff because it's for sure a decline. I don't know that it's like a cliff. We're like, maybe it's like a hill. I don't know. Sometimes we think that's a little bit strong of a term, but I don't want to minimize the impacts that it for sure could have on higher ed. You'll notice that in Utah, we coined the term demographic dip. We're waiting for it to take off. Essentially because Utah's pattern doesn't look the same as the rest of the nation. You can see that where we currently are, we are still growing. Our college age population is not declining like it is in the rest of the nation, or I guess as the nation as a whole. Other individual states might also have different patterns. So we are in a period of growth. We then expect to see a dip, a period of decline, but then again, different from the projections for the nation, we anticipate the college age population picking back up again in about the mid-2040s. So both patterns, I think, have implications for policy in higher education, but I also think understanding the differences between Utah and what the rest of the nation looks like is important here. And if you're interested later, I can get into more of why we think the US and Utah are different, but I will skip that for now for time. This just breaks out what I just showed you, but rather than showing total enrollment, I'm showing the change in enrollment. So again, we're still in this period of high growth, growing by 15 to 20,000 college age residents each year. Starting in the next year or two, we expect that growth to continue, but to decelerate, growing by only 3,000 to 5,000 students, or not students, college age residents, those are not the same. I'll get to that in a minute, each year. So from 2024 through when we stop growing, we expect to gain about 70,000 college age Utahns. And that number I think is important for when we get to the declines. So then we expect a decline. You'll notice though that the declines each year never get as dramatic as the growth that we're seeing currently. So even over this whole period of decline, we expect to decline by about 50,000 college age Utahns. And I think this is important because while we do need to prepare for those declines, we don't anticipate those declines being a decline from the current number of college age residents. We expect it to be a decline from the peak. So the current number we have, we don't expect to have less than that in the next 40 years, which again is different than what we see nationally. And then I don't talk a ton about the growth after that because, to be perfectly frank with you, projections 40 years from now, we hope we're right. We don't bet a lot of money on those ones. We bet much more money on, well, we don't bet any money, but if I was betting, I would bet a lot more money on the ones in the next 5 years than the ones 40 years out. So some of the implications of this, particularly fiscally, we think about our different types of higher education institutions in our state, and they are all funded very differently. You can see here our technical colleges receive most of their funding from state appropriations. They still receive a significant chunk from tuition and fees and from other funding sources. But when you compare that to, regional universities, see about a third of their funding is coming from tuition and fees in that dark gray. Our research institutions, I think a lot of people don't always think about how they're funded. A ton of their funding is not coming from the state or from tuition and fees, but from other sources entirely, research grants and contracts, philanthropy. This particular graph doesn't include hospitals and clinics for the U, or that light gray bar would be even more massive. So we bring this up just to say, when we think about, potential declines in the college age population, the impact that could have on enrollment, it is very likely to impact different institutions differently. So if you look at institutions that get a large chunk of their funding from tuition and fees, we would anticipate it in impacting them potentially more because that is directly tied to their enrollment, right? The number of students they have enrolled, that's how many people they have paying tuition and fees is going to directly affect that number. State appropriations has like some very minor ties to enrollment, but they're not significant. And then other funding is really a mixed bag, but is not tied as closely to enrollment as tuition and fees would be. And then this point I think is important to make. When we talk about the college age population, a lot of times I think people flip that in their brain and think we're talking about enrollment. They are of course not the same thing. We have lots of people enrolled in our institutions who are not of the traditional 18 to 24 college age. And conversely, we have a lot of 18 to 24-year-olds who are not enrolled in college. So they are often correlated, of course. 18 to 24 is kind of the traditional time that people tend to attend higher education, but they're not exactly the same. And this graph I think is helpful because this is showing total enrollment in red from 1970 through 2021. And you can see that particularly from 1970 through 2010, generally, we saw increases, and these are national numbers, increases in enrollment year after year after year. We saw college enrollment growing. There were periods of time in this period where the college age population was declining, yet we still saw increases in enrollment. This is entirely explained by this black line, which is showing the college age enrollment rate. So this is measuring the share of 18 to 24-year-olds enrolled in college. So you can see from 1970 to 2010, this grew pretty dramatically. It used to be that, roughly a quarter of 18 to 24-year-olds were enrolled in college. This got up to 43%. So very significant growth there. So even if the college age population was declining, enrollment was able to grow because a larger share of those students were choosing to enroll. So I bring this up to say that, first of all, projections are subject to intervention and enrollment is not the same as the college age population. So we do not want to send the message that run for the hills, enrollment's gonna fall, everyone's money is gonna be lost and it's gonna be a scary situation. We do think that understanding the data and what the demographics show is important and can help us make better decisions, but we are not sending a message of crisis and fear. I will, of course, acknowledge though that this college age enrollment rate has now, steadied out and even declined over the previous years, or over the last, 10-ish years, which is why we've already started to see some declines in enrollment, even though technically, the college age population peaked last year. We've been seeing these college closure things in the media far before last year. So there definitely would need to be a shift from what's currently happening for enrollment to stay the same or increase, but I think that is possible. I'm not going to dive into all the policy options here, but I did leave copies of the report on the table outside, and it's also available on our website if you're I don't know, a policy geek like me that wants to dive into the policy options, I will just acknowledge that we bucket them into 3 kind of broad categories. The first being to transform. So we think of these as, you know, either fundamentally changing the way something works in higher ed or making drastic improvements to something in higher ed. As an example, we could drastically increase retention and completion rates. If we were to do that, we wouldn't have to attract any new students and our enrollment would increase, right? Because if instead of retaining 40% of our students, we retain 60% of our students, you know, that's going to be a drastic increase in the enrollment that the institutions have. I'm trying to think of other examples of transformation policies. Oh, we could do like a major expansion beyond the college age population. Our institutions could say, you know what, we're really going to target the 25 plus population and really try to make our institution friendly to non-traditional college students. A lot of our institutions, I think, are focused there already. So things like that could help, you know, maintain or increase enrollment and help with revenue streams in the future. The second bucket is to conserve. You can see my little piggy bank to save your pennies. So this is really just to think about being careful during these growth years where we still have 5 or 6, well, I guess it's already 25, but maybe like 4 or 5 years of growth ahead of us. We could do things like, you know, maybe limit new hires, don't stop hiring, but think about, are these hires necessary? Do we need them in the future? We could downshift some of our facility construction, think if can we use the facilities that we already have to bring in the new growth in case the growth goes away so that we don't, you know, build buildings we don't need in the future. And then the final category is realignment, and this is the place that we hope we never get. We hope we can transform and conserve and not have to realign to the point where, you know, you would have to do more significant selling the buildings or realignment of staff. And of course, having a longer headway is helpful, because if you do decide that maybe less staff would be helpful, it's a lot easier to do through, you know, natural attrition over time than having to do it more suddenly. So that's my first thing. Oh, and then we just, again, I kind of made this point already, but we just think that, you know, using the data to strategically plan now really allows Utah to maximize the opportunities, minimize the challenges that the demographic change could have on higher education in our state. The second publication I will highlight, and there's copies of this one out there as well, is just the benefits of higher education, which I realize is very broad. But we released this just in February, hoping to highlight for decision makers, I mean, obviously, the benefits that we think that higher education has. We start by highlighting just how high Utah's post-secondary educational attainment is. I don't know that this is actually frequently well understood, because a lot of the time, myself included, we use census data to try to understand post-secondary education. And if you look at just the share of working age population with a bachelor's degree, for example, Utah ranks high, but it's like 13th, 14th, 15th, it's not third. The thing that pushes us to third is certificates. So Lumina Foundation has a methodology to include technical certificates in our post-secondary educational attainment, which I think is critical to have a full understanding of what's happening. Because if you can see, Utah's on the top, US is below, and with the exceptions of graduate or professional degrees, Utah has a larger share of the population in every degree type, but it is most pronounced if you look at certificates. 8% of Utahns have certificates compared to 4.2% in the nation. So I think this really speaks to the work that our technical colleges do, and also to the focus that USDE has had for a long time on CTE. I was talking with our superintendent the other day, and she mentioned that we're one of the first and only to have CTE requirements in our public schools, like as a graduation requirement. So this connection between K-12 and our technical colleges, I think, really speaks to improving educational attainment in Utah. And then essentially the publication is a giant, I don't know, compository of a bunch of data that makes the case for these 4 things. So higher education lifts people. We show data showing, you know, people with more higher education have higher incomes, lower unemployment rates, lower poverty rates, higher economic mobility, better health outcomes, tons of individual benefits. And then, you know, on the other side of that, also helps societally, helps build civil society. So things that are not necessarily individually tied, but really benefit all of us. People with higher education contribute more money in taxes, and then also are less likely to be participating in public assistance. So by both sides of the coin are kind of saving helping, have more state dollars and then also saving them. And they also are more likely to vote, they're more likely to volunteer. So we just see lots of, spillover effects from education. And then we see tons of data that shows how higher education strengthens the economy. I think most obviously this is through workforce development. Essentially, our higher education is training the workforce over and over and over again, which is, the biggest input to the economy. But also separately from that, the Utah system of higher education, all of its institutions, employ like 70,000 people in total. We estimate that they contribute like $12 billion in GDP. So even from, like an industry employment perspective, there's a big strengthener to the economy there. And then finally, we just include a lot of I'll call them the accolades that Utah gets. Lots of, leaders in our state love to talk about how great Utah is. And I've lived here my whole life, I agree with it. But we just wanted to kind of make the connection that a lot of those things that we brag about really are tied strongly to education. So these are things like having a strong economy. We always rank very high for GDP growth, job growth, and employment rates. Utah ranks first for innovation in the nation, which higher education supports significantly. I'm trying to think of other examples. We rank first for volunteerism, which, as I already mentioned, is tied to education as well. So just lots of different things that, income inequality, we have some of the lowest income inequality in the state. So just some of the examples of why Utah's great and why I think that education plays a role in that. And then finally, I'm not going to spend hardly any time on this. I mostly just wanted to bring it up as a resource to you all if you are interested. The Gardner Institute has started essentially like a landing page that we're calling the Utah Federal Government Nexus, summarizing key economic linkages between Utah and the federal government. So we've released, unless there's been more since I made this slide, we've released 9 so far, and they're continuing to come. For the last like 4 or 5 weeks, we've been releasing like 2 or 3 per week, trying to put them out quickly because obviously things are changing quickly. But this is essentially just to try to help people have some sense of how Utah is impacted with regards to the federal government. So you can see like federal employment breaks down like all the federal employment in the state. You could look at public lands, you can look at Medicaid, travel and tourism. I will quickly highlight just a couple slides from the research funding graph, because the research funding piece, because there's a higher education component to it. Utah received more than $4 billion in research and development funding in the most recent year data is available, so fiscal 23. I find it interesting that actually more than 80% of it went to private businesses, driven almost entirely, not entirely, but almost entirely by a very large defense contract to Northrop Grumman, which is also why 85.6% of our R&D funding comes from Department of Defense. But it is spread across the state. It's not just to one institution. We have more than 100 entities that receive R&D funding from the federal government across 41 cities, 11 counties. You can see we've had seriously significant growth in the last 3 years. These are inflation adjusted dollars from 1970 to 2023. So even after adjusting for inflation, from 2020 to 2021, our R&D funding more than doubled and then has gone up the last couple of years as well. So Utah's become a bigger player in this space. And then just interestingly from the higher ed perspective, of course, our public R1 institutions are pulling the very, very large majority of the weight here. More than 95% of the federal research funding going to higher ed is going to the U and Utah State. Utah State is also a big driver of Department of Defense funding with their Space Dynamics Lab, where the U pulls in mostly health and human services dollars with the location of the medical school and Huntsman and all of the health research they're doing there. So that, I think, is it. So I will go ahead and stop and pass it back to Paul. Thanks.
Great, thank you, Andrea and Brett. So we're gonna do it the same format as last time, except this time Jeremiah gets to get his steps in for today. I will quickly address Connor's question, as I promised I would. These are the concurrent enrollment and AP credits were for those who earned concurrent enrollment or AP. So anyone who didn't take those credits is not included in that.
Follow up, if I may. I know you're running for the recording, right? it's a short question. Thank you. Just, are in terms of determining the cohorts, did any participation in charter put them into that cohort? Or did they have to graduate from there? I just wondered how that cohort was defined.
Correct. For what I presented, it was any participation in charter. We do look at, in the report, we look at intensity of charter school participation as well. Because that makes sense that might, someone who takes a week at a charter school says that this is terrible, give me back to my old school, might not have the same outcomes as, someone who's 9th, 10th, 11th, 12th grade in charter. So we do address that question more in depth.
Yeah, this is a question for Brett. Because in a similar study that I did of AP, it found the same thing where they might only receive 3 AP credits, but they have these outsized benefits. But it seemed like there might have been kind of a self-selection issue that the students were already more prepared. So anyway, did you see, did you control for that kind of thing? I don't know if you have high school GPA, but I don't know, ACT score or some kind of other preparation measure?
Yeah, we did look at a high school GPA as one of the criteria for the propensity score matching, so we did control that way, do some adjustment for self-selection.
I have another question for Brent. In the regression output you showed earlier, I think that it showed an R² value of 0.04. Did you guys experiment with different combinations of variables or add any potential additional variables to attain maybe a different R² value? Or was that the highest one that was found?
Trying to see which one it was. Oh, no, because that was timely completion, and so we didn't experiment too much with it. Since we had already set up initial variables at the beginning, we didn't do much exploratory analyses. So those R sizes are pretty common in this research, so I didn't think too much of it. So it's not as awesome as K-12 research where they have 0.4 R squares.
I have a question for Brent too. Was this concurrent enrollment completion or earned credit? I mean, because there's a lot of students who sign up for concurrent enrollment who do not earn credit. So I didn't know if you were just focusing on students who've actually earned credit.
No, they had to earn credit. So if they withdrew or did not earn a passing grade, they were not included.
I don't want to harp on this because I asked this before, but you had on the last slide, you said that concurrent enrollment has different impacts by different demographic groups. And I don't know what I'm missing, but where was that? Because there wasn't an interaction in the model, right? Which is the thing that would show that. So what were the disparate impacts or that concurrent enrollment had by demographic group?
Well, yeah, I didn't glaze great over that in terms of it was most beneficial for Asian students, and we saw negative impact on Latinx, Hispanic, Pacific Islanders, and 2 or more, the multiracial groups. So.
Interesting. Okay, and that's in the full report.
Yes, it is. Oh yeah, there's so much more that I didn't cover.
I think what she's referring to, I think what you're getting at, so there was no interaction effect, so therefore you cannot account it for that.
Right,
But
so there
just
must be some other model in the full report then to show that, right? Yeah.
And for I want to talk to the Davis Tech folks. We have a tech ed report that's coming out. We just met with them, so we're not ignoring the tech ed people. Breaking.
Our concurrent enrollment is a very different animal.
Question for Andrea. In last Bagels and Research, we saw how the number of school-age children varies quite a lot by county. Did you look at this by county? Do you foresee any issues with that as far as I know people obviously will cross county lines to go to higher ed, but I'm curious if some of those that demographic wave kind of changes depending on what school you're looking at.
Yeah, no, that's a great question. The county, we didn't include it in the report because of the reason you just described. Students are less tied to location in higher ed than they are in public ed, but the patterns are very similar to what you see in public ed. So the college age population is expected to grow in Utah County and Washington County and our more high growth counties, and less so in, Salt Lake County and then some of our more rural counties. So I do think that does matter. Potentially that helps, Utah Valley University more because maybe they can weather the storm if the local college age population there is growing as compared to some of the institutions located in other areas. It's just, yes, it's difficult to tie, of course, especially when you think of Utah State University. Maybe Logan area is not expected to grow as much, but they've got 29 campuses across the state. So trying to shake out where people will end up is a little bit more difficult, but yes, the patterns are very similar to what we see in K-12.
Last question, we are out of time, so. Anyone? Great. Thank you so much, Andrea, and thank you all. See you next year or the next day of research. What are you working right? You're always invited.
Thank you very much.
Of course.
I've got a lot of stuff written down, yeah, I mean, I'm sure we'll have better, presentation.
So SU is done and has been.
Appreciate that.
Pleasure working with
What I do is I go into my signature that I have, and I just copy and paste.
And then I'm supposed to.
Yeah.
But we're doing.
Yeah.
Yeah, we are. We are doing.
Good organization.
Right.
Yep.